Hello, this is Dr. Richard Fleming, and today is Thursday, August 20th, 2020. Earlier this week, I had the opportunity to appear on the Mike Perez Real Talk program, where we went through a number of different treatments available for COVID-19, as well as discuss my concerns about vaccines. Hopefully, within a few days, I will be able to release a published paper that talks about the sequence of treatments available for COVID-19 and how we should be approaching it from the pre-hospital setting all the way through individuals that may or may not require ventilator treatment, but definitely those individuals that require more advanced treatment, specifically targeting the inflammation and the blood clotting. If you've been listening to my different YouTube broadcasts, I've been trying to explain in bits and pieces the inflammation and cardiovascular disease theory that I first introduced in 1994, which explains how viruses are producing the blood clots, inflammation, and swelling that are killing COVID-19 patients. It's not just COVID-19 that this is a problem for, but it's clearly been brought to everybody's attention as we have watched hundreds of thousands die in a matter of 7 or 8 months. This process is going to continue for anybody exposed to the virus who has either a comorbidity that increases their likelihood of forming these blood clots or inflammation and swelling, or the very immune naive who are also at an increased risk for these blood clots and swelling. During the conversation, the host of the program mentioned that most of the bodies in the United States from the deceased have been buried or burned to reduce exposure of the virus to others. And he was, I think, somewhat amazed to learn, as perhaps you might be, that the Italians and Germans have published several papers looking at the consequences of the people who died from COVID-19. And by that I mean they didn't die from COVID, they died from the immune response to COVID. Responses that weren't treated while these patients were hospitalized. This inflammation and blood clotting not only is going to occur when these people obtain the virus naturally by spread from one person to another, but it is also going to occur if these people are vaccinated. The drive for a vaccine is nothing more than the push to expose people to the virus in a controlled setting, if you will, with the hopes and expectations that our bodies will do the right thing. Now, that's what's naturally occurring in the vast majority of people. They don't need a vaccine to get a 3 to 4 day benefit when they will respond within 3 to 4 days with their T cell cytotoxic response. But I'm going on the record today to make it perfectly clear that the use of these vaccines in people with these comorbidities, those who are overweight, which is half of the US population, overweight or obese, 2/3 of the US population, individuals with diabetes or high blood pressure, heart disease, cerebrovascular disease, having prior strokes, or are predisposed to forming blood clots or inflammation in their body for a variety of illnesses. Once these people become vaccinated, they will be at increased risk to die from these blood clots in the same way that they would be if they just simply acquired the virus naturally. The rush and the desire for this vaccine is so that people can take their masks off. And if you've been listening to my podcasts on YouTube, you realize that unless you're somebody who's actually coughing and sneezing, there's really no benefit for wearing these masks. I will be explaining this in a book that's coming out shortly, but in the meantime, it's very important that we get on the record that the utilization of these vaccines across the board is going to have no significant effect on people who have normal functioning immune systems, the people that would normally get this virus and shake it off. It's time to quit testing everybody for a virus to see if they have it when they're asymptomatic. And at this point in time, alarmingly important that we get the word out that the use of this vaccine for people with comorbidities while it won't help the rest of the people without the comorbidities, for those with these other diseases, the obesity, high blood pressure, heart disease, cancer, cerebrovascular, strokes, and other diseases of the like, are at an increased risk for dying from these vaccines. So if you're genuinely interested in the people down the street, that is supposedly the reason why everybody's wearing masks to avoid spreading this virus, you should become actively involved in the effort to stop these vaccine trials. Because as they go through with the normal population that doesn't have a problem and they appear to offer promise now, the truth is they offer no promise for people with normally functioning immune systems, and they offer quite the potential death threat for those with comorbidities.